thank you all for being here and listening, those of you who have stuck it out for the whole day, and also thank you Christina and Mary Pat and Mike for giving us students this space to have a go. So I'm going to be talking to you about loneliness in young onset and rare forms of dementia, one very particular one. First of all, I'm just going to put my PhD in context for you, so let you know the bigger project that it sits within. Then, because today is about excluded populations, I'm just going to say a bit about why this group should be considered an excluded population. Then I will talk about what we did in our study, and then a bit about what we found. We have found loads of things, but obviously this being such a small slot, I'm going to be a bit selective about what I talk about, but yeah, hopefully give you a taste of what we're finding. And then lastly, before some conclusions, I just wanted to talk a bit about neglected spaces as another theme of the day. So my PhD sits within a bigger project, which is one of 6 that was funded as part of the Prime Minister's Challenge on Dementia in 2012. Our project is called Seeing What They See, and it's about visual dysfunction in Alzheimer's disease, which is as a result of changes in the brain rather than changes in the eyes. It's a multi-site project, so it's a collaboration between UCL, Brunel, the London School of Hygiene and Tropical Medicine, and Moorfields Eye Hospital, and it's interdisciplinary, so we have a social science team, neuropsychologists, engineers and ophthalmologists all working on it. So not really anything to do with loneliness yet, but I'll get there. So what makes people with rare or young onset forms of dementia an excluded population? Well, they're a minority of people with dementia generally, so they make up about 5% of the dementia population, which is about 42,500 people in the UK. And I think because of the age of onset and the rarity of their diagnosis, they do face some specific challenges. So this is symptoms that onset before the age of 65. So most of the people we've seen have been in their 50s when they start to have symptoms. And so at this time, people often have financial commitments, so they may still be paying their mortgages. They may be looking after their own elderly parents. They may have teenage children still living at home with them, or they may be supporting children through university. Many of them are still working or are getting ready to retire or have just retired. So the real specific things happening at the age when these symptoms start. And I think because of that, a lot of the general dementia services and support systems are not necessarily tailored to this group's needs. So in that way, they may be considered an excluded population. Also, in terms of what we ask this group in research terms, and especially about loneliness. So the first part of my PhD, I did a review of questionnaire measures that had been used with people with rare or young onset forms of dementia. And one of the areas we were looking at was relationships and social networks. So you would think that would be where the loneliness questions would be. And what we found is that in carers, we ask a lot about relationship quality, satisfaction with relationships, those things that would tap loneliness. But when we talk to patients, people with dementia, we don't ask much about this at all. We ask more sort of functional questions like, can you use the phone? What's your language comprehension like? These sorts of things that all might contribute to loneliness, but we're not explicitly asking them about their experience of their relationship so much. And I think that's just important that we acknowledge the assumptions we might be making as researchers about what these groups can tell us, what we should be asking them, what we want to know about their experiences. Okay, so what did we do? So we had 2 groups. On the right here, you can see this PCA brain is posterior cortical atrophy. So this is the rare form of young onset dementia that we were looking at mainly. And in this form of dementia, the degeneration starts at the back of the brain. So the first symptoms that people have are to do with visual processing. So it would be things like seeing what things are, seeing where they are, navigating spaces. The first symptoms people tend to notice are like trouble driving or reading, that sort of thing. But uniquely, because of where their degeneration is happening, their skills that we usually see decline in dementia, like memory, language and awareness, are quite well preserved. So this group is in a unique position to tell us what they're experiencing, the differences in their experience now to how they were previously, so they can really offer us some unique insights. And we also had a comparative sample of people with typical Alzheimer's disease, that smaller brain up there, who have that more typical presentation of dementia that we think of when we think of dementia, so memory loss, problems with finding words, and a bit of a lack of insight sometimes. So we had 37 couples overall, and we interviewed them at home. So we did an in-depth interview with the couple as a unit, but then we also did separate individual interviews with both halves. And these interviews, if you remember what I said about the general project, were about the problems of visual impairment in dementia. So they weren't about loneliness, but they were very broad. We spoke about the whole day, about relationships, about people's experiences. And loneliness was one of the things that came out of those interviews, and that I was particularly interested in, so that's why it's one of the things I'm focusing on for my PhD. I just was going to say briefly about definitions, that because these three things, so social isolation and social exclusion and loneliness, can be used a bit interchangeably, as people have said already today and certainly in the course of this seminar series, and that we are seeing evidence of all of them in our findings, but I think I just wanted to be clear that what I'm talking about today is loneliness and that gap between the relationships that people want to have and the relationships they are having. And I think it's important we keep those distinctions if we're going to really untangle how these things are related and what the implications are of that. So this, as I said, this is a snapshot of findings, so hopefully some interesting bits. So generally we found that yes, people with this posterior cortical atrophy do experience loneliness. So there's two quotes from Louise here. She says, first of all, I can't drive, so I can't move about freely. I don't read anymore. I can't read anymore. I find it a bit lonely, you know. Richard's still in work. He's not always around. I can't get about here. So that was quite tied to her practical difficulties. She can't read, she can't drive, she can't navigate her environment. And then she said more broadly, it's horrible to be lonely. You're not put on this earth to be on your own. You're here to be with others. So there she's talking more about a general sense of loneliness, this kind of all-encompassing type loneliness that she's experiencing. So I wanted to know what it is about this group of people with these very unique profiles of impairment that are leading to this kind of general sense of loneliness. And I think on the one hand, they have these complex perceptual difficulties which make very simple tasks very difficult. So things like dressing or reaching out to pick up a cup, other things we were talking about that might be important for maintaining relationships, so using the phone or walking around the corner to a friend's house, all of these things become really difficult because of the perceptual problems. And there's a quote here from Susan, a woman with PCA, who said, I've been lost outside my own house, sitting on the doorstep because I'm not always sure if this is my house or not. So I think we all hearing that can appreciate that it would be really distressing and quite a profound impairment to be on your own doorstep and not know if that's your house and if you can go in. I think she used to wait for the postman and then ask him, am I all right if I go in there? So that's the kind of nature of perceptual difficulties that people are having. But on the other hand, they've got these remaining cognitive functions that we were talking about, like language, memory and insight. And I think because of those functions, they can almost have this illusion of ability. So because the people with PCA, they're very coherent, they're very eloquent, as you can see, they can articulate their experiences perfectly. They understand their diagnosis and what it means, especially in the early stages. So they're very aware of their own abilities and inabilities. So Jack here, he said about his wife Camilla, Camilla's quite aware of everything she can't do. So in one way, that means that Jack can go out for the day if he needs to. He can leave Camilla at home. She's not going to try and use the gas. She's not going to go wandering. She's not going to be of any great risk to herself, which is great. That's good that she can do that. But it also means that she's aware of all these problems she's having, and she knows how poorly she's functioning compared to how she used to. So we find people with PCA may be left in their home environment considered safe, but they can't actually do the simplest of tasks. They can't ring their friends, they can't walk around the corner for a chat, these sorts of things. Another thing that comes with this awareness, I think, is this ability to reflect on the past quality of relationships. So people are able to compare the relationships they're having now with relationships they might have had in the past and see that gap that we're talking about with loneliness. So I think those two things contribute to this general sense of loneliness. And then also, as Amy was mentioning earlier, I think there are some certain types of relationships for people that they can have loneliness within those relationships in and of themselves. So in the marital relationship, this is Annabelle, who was a carer of someone with PCA. She said, he's my soulmate, but he's not my, he's my husband, but I'm not his wife. And similarly, in a parent-child relationship, Linda said of her mother who had PCA, when I come around here, I feel I'm more to the list of carers really, the quality is gone. So you can see these difficulties people are having. There's a lot of change in roles and responsibility, the dynamics of relationship change, and therefore the quality of those relationships change. So people can experience loneliness within the context of one relationship. Similarly with friends, Trudy, who has PCA, said they're sort of cautious coming to you to give you a hug and things like that, and you know that they're not quite sure about you now that you've changed. So again, she's making a direct comparison in her relationships now, the same friends that she's known for years probably and have always been fine. She's able to make that comparison because she has that awareness and ability to reflect. And then this Annabelle again said something which almost implied this kind of shared loneliness that she has with her husband who has PCA. So she said of their friends, you feel, well, who wants to know us? So this is them as a couple experiencing a kind of shared experience of loneliness in terms of they can't maintain the friendships that they used to together. And then I also wanted to say something about the people who aren't lonely, because as you say, Michael, everyone's different and manages things in different ways. So not everyone was lonely, and there were a few strategies that people seem to be using. So one of them was maintaining this normality, or like the pre-disease kind of let's keep things going as they were then, to prevent these changes in relationships that can cause loneliness. So this comment from Betty at the top, these are about friends that she actually met at a PCA support group. So she wouldn't have made these friends if she didn't have PCA. But she said of them, it's just like usual good friends. They're just good friends from the way your life has just turned around. So she's almost downplaying her disease or her dementia diagnosis and sort of making these friendships equivalent to the friendships she's always had. She's not friends with these people because she's got PCA, they're just friendships as they always would have been. And that helped her to feel connected in a meaningful way as she always had done with people. And then Trudy, again with PCA, said of her youngest daughter, if she wants to have a row with me, she'll have a row with me. She treats me exactly like she should. And it was really important to Trudy that she could still argue with her daughter, that it wasn't like people were going to be tiptoeing around because she's got PCA, we must treat her differently now. Or, and yeah, that was really important to maintain the quality of the relationship, so the good bits and the bad bits, and just keep things the same. On the flip side, there was some people who sort of re-identified in terms of their diagnosis. So maybe embraced the diagnosis more, or sort of acknowledged the challenges of it more and built it into their way of living. So Sarah was a carer for her husband with PCA, and she said of friends at the same PCA support group, being with somebody else who is a sufferer, they think that maybe it's sharing it a bit. So she's talking about if you acknowledge the disease and all its challenges, then you can make new friendships which are meaningful and purposeful and not feeling lacking in any way because you're both supporting each other with the things that you need. So just different ways that people aren't lonely. And the last thing, because today is also about neglected spaces, I just wanted to talk about the home, because we saw everyone at home, and most people with dementia are still living at home. But I think the literature, especially in dementia, we can maybe neglect the home environment in that we assume it's a place of safety, a place of comfort. It's where most of us feel safest and most comfortable and have many happy memories. So I think, yeah, as researchers, we can make assumptions about the home, and family members certainly can think, oh, as long as she's at home and she's got all the stuff she needs and she knows her way around, and then that's fine. But I think when people start to experience this kind of profound loneliness that they've shown us that they do in PCA sometimes, for that home environment, the safe context to become the seat of that kind of loneliness experience must be quite distressing, and maybe we could pay a bit more attention to that environment and what it means for people. So I've just got two quotes from people about their home environment. So this is Susan. She said, "I keep saying I have seen this wall, I'm fed up with this wall, what must I do?" And this was Susan, who was sort of sitting just in one chair mainly throughout the day because she couldn't navigate her way around the space. And this is her home that she's lived in for years and is obviously very comfortable in, but it's now that sort of host environment for these feelings of loneliness that she's having. And then Louise with PCA said, "I can see the odd person that walks by occasionally, otherwise I don't see anybody." And Louise really wanted to be out of the house. So her husband felt she was very safe at home. She wanted to be out and talking to people in the shops and meeting her friends and these sorts of things. So then in conclusion, I just wanted to say that people with rare or young onset dementias do experience loneliness, and that they might be in ways which are specific to their age of onset or their diagnosis. So what I've spoken about today comes out of these perceptual challenges that are very specific to this type of rare dementia. There are other rare dementias which have different profiles of impairment and possibly different manifestations of loneliness. And that these can exist across and within relationships. So I think we don't necessarily want a global measure of how lonely are you. People may be very fulfilled in certain relationships but lonely in a particular relationship. And they need specialised support for those different relationships, for their different diagnoses, their different age of onset. And just a warning flag to us as researchers, if we're going to sort of build that knowledge base to inform those specialised supports, I think we need to just be aware of the assumptions we're making about who we're asking about loneliness and how we're asking it and where maybe we're asking it as well. And that's it. Thank you.
Thank you.